Hello, everyone, and welcome to this audio podcast. This audio podcast as part of a Bostix Series. This audio podcast as part of a LaBox Infaction. This audio podcast as part of a Storm Quota, and this audio podcast as part of a Storm Bostix production. In this audio podcast, so I'm looking at now, looking at sort of epidemiology, and looking at epidemiology in around the CKD in amongst the CKD population. So an estimated 15 million plus patients or recipients in the United Kingdom have at least one long-standing condition or long-term condition, and about 2 million in amongst the adults population in the United Kingdom have been diagnosed with moderate to severe CKD or chronic kidney disease, and around 70% of the total health and care expenditure in the United Kingdom is attributed to patients or recipients with long-standing conditions. Much of the monitoring in patients occurs into mild and moderate severity of the disease or stage of the disease by and according to general practitioners in primary care, with only one of the final stages of the disease managed in secondary care. The epidemiology of actual CKD or chronic kidney disease in the United Kingdom relates or regards to what has been outlined in the National Institute on Care Excellence guidelines, and in the kidney disease in the kidney disease and sort of quality outcomes quality outcomes framework or KDIGO guidelines. Similar epidemiological contexts had been informed by primary data by the Health Survey for England retrospectively in around 2009 to 2010, using estimated glomerular filtration rate and albuminuria. Using EGF, estimated glomerular filtration rate and albuminuria. The incidence rate of CKD in the United Kingdom increased from 109 per million population PMP in 2013 to 115 PMP in 2014, reflecting renal replacement therapy initiation or RRT initiation for 7,411 new recipients or patients. The increase in incidence rate from 2013 to 2014 was seen or identified in the United Kingdom, or it was seen in England and Scotland. The median age of all incident patients was around 65 years, although highly dependent on ethnicity. 66.4 years for white for Caucasian patients, and 58.7 years for non-Caucasian or white patients. The 3% increase to the NHS in 2009 had increased the number of patients or recipients requiring RRT in 2010, and this is causing or has caused issues in amongst the NHS sort of retrospectively, and a stance is or had been needed to consider the trends, and this could contribute to contribute an improved service and management of actual CKD. That draws this audio podcast to a close. This audio podcast as part of a Bostix series. This audio podcast as a LaBox Infaction. This audio podcast as part of a Storm Quota. And this audio podcast as part of a Storm Bostix production.